Hello, my name is Jayson and I have type 2 diabetes. My A1C has changed over the course of my first diagnosis to my usage of the program. It was first around 12 at the time of first diagnosis, and it went down to 8, and by the time of starting the program, working with Wendy, it had gotten down to 5.5. It went down significantly, so much so that my doctor was pleased to be able to adjust my medication downward. So that was reassuring. When I was first diagnosed, the doctor who I was, or other healthcare provider I was assigned to, did provide information. What my health coach added to that for me was a greater emphasis on learning self-advocacy. Since completing the program, I have a greater sense of ownership. It feels less of a burden to manage my symptoms, manage my diabetes. It's become more integrated. It's something that's just something you do, part of the day. Compared to when I was first diagnosed, I am much better prepared in managing my diabetes, I feel. At first it felt very overwhelming. It's now much more manageable. I think part of that comes with just practice and experience, but also with working with someone that's helping you find a better perspective on dealing with the day-to-day. As a result of this program, I have improved my ability to integrate the purely medical side, daily meds and injections, with the dietary side, and also the exercise side. I'm trying to be more mindful of what I'm putting in my body, and when and how much and over what span of time, and trying really hard to manage my weight and exercise. And I think that was directly a result of the program. I would say it was very important to have the CDE be aware of and sensitive to my schedule. She was very, very accommodating. She would always ask. Was always very polite, very courteous, and like I said, very amenable to. She would ask, if that was okay, if such and such a date and time was okay. It was very helpful to be able to do it from home over the phone. Yes, very helpful. I would talk with Wendy primarily in the afternoons and evenings. The biggest thing I learned from working with Wendy was that while this could be a life-altering situation, it didn't have to be a life obliterating situation. It's something that you could adjust to, and that there are more options in terms of how you go about your daily day-to-day business with managing it, particularly self-advocacy. That was very empowering, knowing that was something I could legitimately expect a healthcare provider to respond to.